There are 4 main types of dementia. Each type has slightly different symptoms, and to confuse things even more, a lot of them also overlap. Hi, I'm Dr. Knight, a geriatric and general internal medical registrar, and this is Getting On, the series where we try and stop worrying about getting old and just start getting on. Welcome to our series on memory. So the first main cause of dementia, as I mentioned before, is Alzheimer's dementia. So it's the most common type of dementia, and about 2/3 of people living with dementia will have Alzheimer's disease. It's caused by a buildup of amyloid or tau proteins, which are basically abnormal proteins that shouldn't be in the brain. These create lots of tiny sort of clumpy areas in the brain that we call plaques or tangles, and these affect how the brain cells function, and they damage normal, healthy brain cells. The most common early signs in people with Alzheimer's dementia are the classic memory loss or problem-solving difficulties or the ability to plan. Now, Alzheimer's disease itself has its own subtypes of Alzheimer's, which I won't go into, but each can present slightly differently, so can have slightly different symptoms. Things that put us at an increased risk of getting Alzheimer's dementia include age, just because with time we're just more likely to accumulate the likelihood of getting into certain disease, and sex. So actually being a woman makes you more likely to have Alzheimer's. But again, we think that tends to be because women live longer and therefore their likelihood of getting Alzheimer's disease within that time is increased compared to men. Our genetics also play a part. It's a little bit complicated, so there aren't really many genes that you can inherit that mean you will definitely get Alzheimer's, but we can inherit genes called risk genes, which can slightly increase our chance of getting Alzheimer's. So it's a bit complicated because the same gene in one person might not lead to dementia, but in another person, in a combination with different things, might lead to dementia. As always, lifestyle factors play a part, so whether you smoke, how much alcohol you drink, what you generally eat and drink, whether you do exercise, whether you have had multiple head injuries, if you've got different health conditions, all of these things in combination can potentially reduce or increase our risk of getting Alzheimer's dementia. And actually it's said that if we have a really healthy lifestyle, particularly between the ages of 40 to 65, that can really help lower our chances of getting Alzheimer's dementia. The second most common type of dementia is called vascular dementia. And this is caused by a reduced blood flow to the brain, either from strokes or from narrowing of the blood vessels. Common early signs of vascular dementia include difficulties in problem solving, problems with planning and organising, making decisions or solving problems. But again, just remember, different symptoms can occur in different dementias and they're different for different people. In vascular dementia, you tend to see this classic stepwise deterioration in brain function. And that's because each time a sort of vascular event happens in your brain, so a stroke or a clot, a small clot, you kind of get this sudden decrease in brain function, and then you'll stay stable for a while, and then another brain event will happen and you'll have another reduction in brain function. So it's called a stepwise reduction in your brain function. Now, there are slightly different risk factors that cause vascular dementia as opposed to Alzheimer's disease, although there is quite a lot of overlap. The main one is that vascular disease really is about your vasculature and the health of your blood vessels and your heart. So if you have a cardiovascular condition, you are twice as likely to develop vascular dementia. Those kind of conditions include high blood pressure, diabetes, or having heart attacks or strokes before. So all of those lifestyle factors that we've mentioned, like whether you smoke, whether you have high blood pressure, whether you exercise, how you eat and drink, as you can imagine, they all have a really big impact and can influence your risk of having vascular dementia. The third kind of dementia I'm going to talk to you about is something called dementia with Lewy bodies, also called Lewy body disease, and it's really commonly associated with something called Parkinson's disease, which is a movement disorder. You don't have to worry too much about this, but basically is caused by different protein deposits called Lewy bodies in the nerve cells themselves, and that can lead to brain dysfunction. Slightly different and more subtle signs that you might experience with Lewy body dementia include difficulty in staying focused, experiencing hallucinations. Particularly, you might also notice some problems with your movement, so slowing down of your movements, and also it tends to be associated with sleep problems as well. And then the last kind of dementia I'm going to talk to you about is something called fronto-temporal dementia, or Pick's disease. Now, fronto-temporal literally means that the disease is affecting the front and the temporal, so the front and the side parts of your brain. And again, this is due to an abnormal clumping of proteins in the wrong parts of your brain. Now, because of the areas it affects in your brain, the front and the side, you tend to notice more changes in personality and changes in behaviour as the most prominent symptom in this kind of dementia. You also tend to get it when you're younger. So we tend to diagnose Pick's disease in patients who are younger than 65 years old. So those are the 4 main types of dementia: Alzheimer's disease, vascular dementia, Lewy body dementia, and frontotemporal dementia. It's important to understand that sometimes you can have a mix or an overlap of dementia. So for example, you could have Alzheimer's disease with an element of vascular dementia as well, particularly if you have some of those more prominent cardiovascular risk factors. Dementia is not a natural part of aging, and not everyone that gets old will get dementia. Although for some people, unfortunately, dementia is inevitable, there are definitely things that all of us can do to reduce our risk of getting dementia, and I'll address that in the rest of this memory series. In the rest of the series, we'll be looking at what to do if you're worried about your memory and how we can reduce the risk of getting dementia ourselves. Thanks for watching.